Good evening. Welcome to Today Interview Time. Great Mongolian poet Natsigdorj once wrote, "Happiness, happiness, happiness. There are thousands types of happiness. The most important happiness from all of those is health." A special envoy of the President for Global Health Initiatives of Republic of the Philippines and nominee to be Regional Director of the World Health Organization in the Western Pacific region, Dr. Susan Mercado, is in our studio. She has dedicated over 30 years of her lifetime for the public health. Good evening, ma'am.
Good evening.
Thank you for coming to our studio.
Thank you very much.
Well, let's just start talking about your background. So you have a philosophy background, but how did you turn into health, especially public health?
You know, many
from
years
philosophy?
ago, I wanted to become a lawyer, so I studied philosophy. And I wanted to become a lawyer because I wanted to work in the area of social justice. But at the age of 18, I developed a very strange kind of kidney disease where I thought I was going to lose my life. But I recovered, and when I recovered, I said, you know what, I think I want to be a doctor. So I studied medicine, but when I studied medicine, again, I decided later that my passion is social justice. And so I went into public health, and I think those two areas are not too far away.
Yeah, too far away, yes.
Right. So I do work on health laws, regulations, policies, and you know, looking for how we can bring health to everyone.
So you have a vast experience working at the World Health Organization. Can you share some of your experience?
The thing about working internationally is that you begin to realize that what you thought were just your national problems are shared by other countries. So I used to be Deputy Minister of Health, Vice Minister of Health in the Philippines. And when I was Vice Minister of Health, I thought, wow, you know, so many problems in my own country. But when I started working internationally, I realized that, hey, look, you know, the problems that I have are being faced by so many others. And that's where the World Health Organization comes in, where we're able to get people to sit down, share their experiences, and learn from each other, because there are solutions out there. And we don't need to reinvent the wheel. We just need to learn from each other.
Well, since you're based in Philippines now, I want to ask about the Philippines government and the Sanofi on the dengue vaccination scandal. What really happened and how was it solved? And when it comes to vaccination, what do we have to focus on as a nation?
There have been a number of vaccine-related controversies all over the region. And for the Philippines, it was a very painful experience, if I may say.
It was quite big on the media.
If I may say so myself. Because I worked in the Department of Health before, I know how important vaccination is, and I still truly do believe that this is one of the pillars of public health. So it is very important for leaders not to take any shortcuts when they are developing vaccination programs. You have to make sure that you've got the right vaccine. You have to inform the people, educate them about it. You have to make sure that you're not bypassing any of the rules, that you're being extra careful, because vaccines are given to healthy children. So what happened here was there was a rushed process. I was one of the resource persons for the Senate that investigated this problem. And I was reading like 500 pages of administrative documents a day. And I could really see that there were shortcuts that were taken that should not have been done. People were not that cautious. They were in a rush. But we leave the final verdict to the courts. So criminal and civil cases, I think, have been filed against those who were involved. And we hope to see a resolution very soon. But it has been a painful lesson from the Philippines. I actually through my travels, I've noticed that people have been watching what's been going on there. And all I can say is that when it comes to vaccines, we all have to be very careful because vaccines are so important. We should not do anything that will remove the trust of the people for the government vaccination programs. And in this particular case, that was what was happened. And that happened. And we paid, I think we're paying a big price for the shortcuts that were done by the leaders who decided on this.
And about WHO Western Pacific region, what were the biggest projects that were implemented recently throughout the region?
I would say
you are being nominated for the director.
I would say that globally, the two most important achievements of the World Health Organization, which reflect into the region, are one, the passage and the implementation of the WHO Framework Convention on Tobacco Control, which is the first and the only global treaty that we have on health, and which has made it possible for all countries to regulate a very harmful substance that causes heart disease, cancer, and so many other problems. The second one is the International Health Regulations Platform. And this, again, is a global initiative, but it allows countries to share information and to quickly arrest any kind of an outbreak of infectious disease that could be coming from one part of the world. And that, again, is a test of how WHO can govern and can prevent infections from spreading. So I would say those are the two most important. There are many, many things that have happened, but since you're asking me the two most important, in my mind, those are the two most important for me.
And when public health is concerned, there's always big chunk of money involved. But in the world, there's lots of money now.
It's true.
Right. How do we channel all this wealth to public health much more? From your perspective,
that's
what are the solutions?
Yeah, that's a great question because the world is actually wealthier than we've ever been. But it's not necessarily healthier. And I think I think we're putting in a lot of money into treatment and cure and management, and that's not a bad thing. But I think too many things are happening in the environment that are creating health risks that are making us less healthy. So, for example, there's a lot of food out there that's got too much salt and sugar and fat for us. It's a lot of processed food. For example, the quality of the air that we breathe. Air pollution is a cause of cardiovascular disease. Water, the availability of safe drinking water so that people won't develop diarrheas and other infections and so on. So I would say that the best way that more money can be put into public health is for governments really to think about their sustainable development goal plans and think about all the health components of that, because the sustainable development goals cover so many things. They cover poverty, nutrition, cities, islands, employment, and so on.
Gender and so on.
Yeah, gender. But all of that has something to do with health. So if we think about investing in all of these sustainable development goals as they contribute to health, we will be doing more prevention and promotion.
How do we attract the private sectors, private companies, big corporations, the ones who with the money?
Big corporations are very much a part of the solution to our health problems. And I really am a believer in governments working with the private sector to solve problems. I'll give you an example. I was in China recently, and I like to eat yogurt. But then sometimes yogurt has fruits and flavoring, and it's too sweet. So in China, I was at a convenience store, and I bought a pack of yogurt, and it had the sugar separated from the yogurt. So there was a pack of sugar there, but it's not mixed into the yogurt. So of course for me,
leaving the decision to you.
Yes. So I threw the sugar away and had my yogurt, which was plain and bland, and I really liked it. And I think that's good for business, and that's a way business can help people develop healthier lives. Give them more choices, provide healthier options, and stop investing on things that are destructive. So tobacco, electronic cigarettes, alcohol.
Sugar,
Yeah,
sugar.
lots of sugar. These things make money for you, but it makes people sick. And when people get sick, they're less productive. And if they're less productive, they have less buying power. They have less buying power, it's bad for the economy. Then no one's going to buy your products. And if we get more of the private sector to invest on healthy products for people, business will be better.
Well, my next question is related to Philippines, and Philippines was quite trendy because in 2006, 2017, because of the drug war. And the Philippines has taken very decisive step towards the drug war. In Mongolia, the situation, Mongolia has been introduced to this drug use problem very recently, and now it's increasing rapidly these days. What should we do? And what is your stand on this drug war?
Well, the Philippines has had a drug problem for a very long time. And I think people have swept it under the rug. It's like something you want to ignore. But ask any family, and they have a member who has fallen victim to illicit drugs. And our president, President Duterte, campaigned on a war against drugs because he knew that, especially for the less advantaged or disadvantaged part of the population, the poorer communities, this was really destroying the youth. Now, I looked at some of the data that we have on drug use, and 1 out of 10 13 to 15-year-old kids in the Philippines is
13 to 15?
Yes. 13 to 15 is experimenting with drugs, already experimenting with drugs.
And 1 of the 10 kids?
Yes, 1 out of 10. And we knew that data 2 or 3 years ago, but, you know, what was being done? So the thing is, when the new president came in, because he was a mayor and he had very good success in cutting the supply of drugs in his hometown in Davao, he made that a national campaign. And so I think enforcement and cutting off the supply chain is very important. Now, it is not easy because drugs is related to money and syndicated crime. This is not, we're not dealing with peanuts here. We can't deal with kid gloves on this. This is very serious problem, and it requires political will because political leaders, the police, enforcers are all involved in protecting drug syndicates. So his leadership has brought this problem and the sort of very strong approach he has to international attention, not without critics. Of course, there are critics.
Yes.
But people generally feel safer. I would say there are less people who are using drugs, and there could be more that can be done now to protect children from not getting into drugs. Now, having said that, young kids will not go into hard drugs right away. There are gateway drugs. So they usually start with tobacco and alcohol. And so you have to also regulate tobacco among minors and alcohol among minors. And something has to be done about violence that youth experience. And I think raising awareness about the problem is very important. But it's so important for the leaders of the country to say that they want this to stop.
So the leaders need to take decisive action when it's early.
Yes.
When it's not too late.
When it's not too late. Because when it's too late, like in our case, it's so difficult because of the entrenchment of the enforcement agencies and the suppliers into one business. It's a business.
What are your views on the sexual harassment reports on the workers of the aid agencies?
Frankly, it's shocking, but I am not surprised. As a woman and as a woman candidate for a leading position in the World Health Organization, from the very beginning, I already said that if I am elected as regional director, I will have zero tolerance for bullying and sexual harassment in the workplace. And the reason why I said that is because through my years in public health, I have seen it. I've seen it. Now, I don't want to get into details about where and when and who and so on. I think the important thing is what is the solution. Now, I was listening to television discourse on this the other day, and they were saying, oh, we should have hotlines and people should know how to call and what. I'm like, that's like the end of the line. It's like you're allowing it to happen, and you just want to help people if they're victimized. I think we should put in more proactive policies in international aid organizations in the United Nations that
Proactive.
ask all applicants, anyone who wants to enter a humanitarian agency or the United Nations or a development work agency should be asked a screening question, and that is, have you ever been charged or have there been complaints against you because of sexual misconduct, harassment, and so on?
But can we find out the real person behind those questions, by those questions?
Of
We
course,
don't
people-
know. I
of
mean,
co- yeah.
if I was a sexual harasser, I wouldn't say I am a sexual harasser. Do you know what I mean?
Yes, but it sends a signal, right? Because if you're going into international work and into humanitarian aid, your integrity is very, very important. Now, you could lie. You could say, of course, no, right? But you will now think very deeply about doing something that could compromise your answer of no, I never did. So it is a way of deterring. I think it would be a very strong way of deterring.
Sending the sign.
Sending a signal that, you
Letting
know what,
know,
you might be very bright,
Uh-huh.
but if you have had
Something.
done something in the past, we want to know, because probably you need help and maybe we can offer it. But then if you lie about it, then it was not, you cannot blame the organization for, cutting you off right away if you do something that is undesirable.
Exactly. So, from what you have said, overall, small, smart steps needed. Very simple steps towards the public health development. How should we live healthy from the personal perspective? What should we do? How do you see the health, like personal health care?
Okay, health is a personal responsibility, but we must always remember that behavior is shaped by the environment. So for people who are well off, who have the means, let us say, to choose healthier food, to exercise, to live in a cleaner place where they have water and sanitation and all of that, then it is just about making the right choices and living a healthy life. But millions of people don't have that choice. They don't have water. They don't have safe food. They have to eat the cheapest, lowest quality food. So it is a personal responsibility, but health is a social responsibility as well. And it is a government responsibility to make sure that citizens have a fair chance, have a fair opportunity to have health.
Then we can talk about the personal responsibility.
But personal responsibility is very, very important, because at the end of the day, people will have to be responsible for themselves, because no one else is going to take care of you except yourself. And having knowledge is very important. So what you're doing, talking about health on media, on national television, is very important, because information is one of the most empowering tools for public health and for people being able to take control over their health and their lives.
Well, thank you, Mayam.
Thank you very much.
Thank you for coming here and talk about health in general. It is the most important happiness of all the happiness.
I agree with you. I agree completely.
And I wish you good health and good luck for the election as well.
You too. Thank you very much.
Thank you very much.
Thank you.
That's all for today. Thanks for staying with us. We will see you on next Tuesday with more news and information. Have a good one. Bye-bye.